Dr Jacky Davis, a consultant radiologist, a BMA council member and founder member of Keep Our NHS Public. Good morning to you, Dr Jacky.
Good morning.
Anything in this survey that surprises you from public feelings about failings within the NHS?
Oh, golly, it's tragic, isn't it? These long-term plans that Labour are looking at, the tech stuff, turning treatment into preventative medicine and all the rest, that's great in the long term. And we've heard it many times before.
We have.
And we do need the tech stuff. But what are the public seeing? The public are seeing exactly what was outlined in that survey. They're seeing they can't get an appointment with their GP. They're seeing, if you have dealings with hospitals, that people are having to wait in ambulances. If they can get into an ambulance, they get into A&E and they can't get out. And that is the public perception. And people are suffering because of that. And if you've got a waiting list of between 7 and 8 million, there'll be many people on there, not only people suffering, but people who actually can't go back to work. So it's really bad for the economy at the moment. So none of it's surprising. And I think what I'd like to do really is to bunch it into two things. There's that the long-term plan that Labour are talking about, and that's great, but it's not going to do anything today or tomorrow, probably even next year. We need to look at sorting out the problems that the public have identified, and that's who we should be listening to. The A&E waits, the ambulances, the GP appointments in the hospital. And I thought it was really interesting what you said, that when you had a problem, and I'm sorry to hear about that you had very good treatment, but the circumstances were so dreadful.
Yeah.
Individuals who go into will tell you the staff are fantastic.
You probably can't answer this, but what I'm looking at is it's a study. I don't know whether everybody who's responded to that survey has actually had NHS experience or contact in the last 12 months, the last 5 years. I don't know if they've had to call for an ambulance. I don't know if they've experienced delays to ambulances. Many of those opinions could be formed by the media. My experience has broadly been, I've had acute pain, and by and large, the service has been good. There were delays in the waiting room, but that at the health service, and I've had problems with my MRI. But other than that, the ambulance crews were quick. They were excellent. The hospital treatment, once I got it, was excellent. There was a wait, but it was the middle of the night. I expected a wait. And my experience has been broadly pretty good.
You're absolutely right. If you talk to people who've had individual experience with the NHS, they'll say, well, of course, I had a fantastic experience. It may be that the infrastructure is a bit crumbling, but the staff, and the NHS is absolutely kept afloat by its staff. Let's be clear about that. But the staff were fantastic. And the reason that people have a bad impression of the NHS is that the media only ever tells us the bad news
stuff,
and not the good news. And what we would like to see is to address the current problems, which are really to do with lack of staff, and that comes down to lack of money, and lack of beds. And one of the reasons there's a lack of beds is you can't get people out of hospitals.
And that's because there's no social care system, which we're going to be talking about at 9 o'clock. And unfortunately, we're going to be talking about it in the context of Labour kicking that issue down the road. Once again, Dr Jacky Davis, thank you. Thanks for joining us this morning. Also, thank you for all the excellent work you do within the NHS. So